PhD, the inventor of email, a scientist, inventor, entrepreneur, a Fulbright scholar, holds 4 degrees from MIT, including his PhD in biological engineering. He started 7 successful high-tech companies, providing thousands of jobs. And of course, I curse him for creating that evil thing called email that distracts me for hours a day. But, you got to do something for humanity. Welcome, Dr. Shiva.
99.1 FM Talk. Hi, Monica. How are you?
I am doing fabulous, and I hope you are as well. I am seeing a biological engineer. What exactly is that, Dr. Shiva?
Well, it's a good question. So what is a biological engineer? So in 2003, Monica, what happened was there was a major revolution in biology that took place. Up until 2003, the idea was that, do you remember this thing called the Human Genome Project that started in 93? The goal was they were trying to map out every gene in the human body, right? How many genes we had. And the idea in 1993 was, the estimate was we probably had about 1 million genes. And the reason they came up with that estimate was they said they knew a little worm only had 20,000 genes, okay? So they said, wow, we're more complex. We must have more genes. So in 2003, guess how many genes we have?
Isn't it like billions?
Nope, we only have 20,000 genes. We have the same number of genes as a worm, okay? So this was a major shock to the scientific community, because up until then, the idea was the number of parts of a system means more complexity, right? A worm had 20,000 genes. That's got 20,000 parts. We must have more. So what does that mean? So flip biology on its head, because it turned out that genes are not who we are. Genes are just a very small portion. Genes create, all these other proteins, and the proteins talk to another. In fact, the protein coding genes are only 5% of the entire DNA. So this has essentially blown biology out of the water, in the sense that people realize that we don't really know biology. It's not about individual genes. It's about a systems biology. We got to figure out how the individual genes connect to proteins and all the chemical reactions. So in 2003, I was running one of my other companies. I'd done 3 other degrees already at MIT. And my advisor said, Shiva, you got to come back to MIT. You've always loved medicine, and you created email. You're an engineer. You can build stuff. There was a big grand challenge that the National Science Foundation put forward, which was they recognized we got to move out of the nucleus, right, where the DNA is. We got to start understanding the entire human cell. And could we mathematically model all those chemical reactions? So that led to a field called systems biology. And MIT literally created a whole new department called biological engineering. You know how you have chemistry, where you understand the laws of chemistry? There's a field called chemical engineering. But biology didn't have a biological engineering field. So the idea was, first, we're understanding how organisms work, but now we don't have an engineer's approach to understand biology. So that department got created in 2003. I came back and I spent 4 years doing my PhD in this new area called systems biology. I was one of the first PhD graduates. And what I had created was I created a technology that could use the computer, Monica, to actually mathematically model the entire human cell, or for that matter, different diseases. People didn't think this was possible. It's a very, very tough problem. And that's what I solved. And then I spent from 2007 till now creating a company called CytoSolve, CYTOSOLVE, which is a company we want to basically use this approach to discover the cure for pretty much all different ailments using natural products, right? So imagine you eat, some turmeric, and you have some red wine. How do those things interact? Right now in the field of nutritional supplements, people just throw all sorts of stuff in. If you ask them, how did you come up with that? They just do a lot of hand waving. With CytoSolve, we're actually able to mathematically model inflammation on the computer or Alzheimer's. And we're able to eliminate the need for animal testing and find what is actually occurring. And as the science gets better, so will our products. So that's what we do. So I do a lot of educational programming, helping people understand at the molecular level what's going on. And then we help people, figure out, I'm a systems guy, right? So anyway, it's a systems approach to biology. That's what biological engineering is. It's a whole new breed of engineers.
This makes more sense for me now since you said that about the vaccine that actually isn't a vaccine that is being pushed, because it is actually gene therapy.
Well,
what do you think about this?
Right. So I've been in the field of health since I was a kid. I grew up in India where my grandmother was a traditional healer. I saw her use traditional systems of medicine. And the entire journey for me started with the love of medicine, even working at that medical school when I was 14, where I created the first email system. But I was always upset that medicine didn't consider the body as a whole, meaning looking at all the parts. You see, you go to the doctor today and they say, okay, take this medicine or get this injection, right? And that's where we're still at. So when you look at you're looking at the mRNA vaccine, right? What is it?
Mm-hmm.
And furthermore, we have to step back. What is a vaccine? Well, the concept of a vaccine was created in order to upregulate, have your body produce something called an antibody. Okay, that was a goal. So if someone sneezes on you, right? Your body, first of all, experiences those particles in what's called your parts of your eyes, your nose, right? That's called your innate immune system, and your body will generate all these immune cells will try to go take out that virus, right? That's called the first immune response, Monica. Okay. Then your body then creates a whole system of molecular reactions called the interferon system. And these are very powerful things that turn on genes. And no one talks about this, by the way, when they talk about vaccines. And there are people who, for example, get infected by some virus, but they don't have any antibodies, but their body's absolutely fine. Why? Because the innate immune system and the interferon system created amazing molecules that your body has, and it protected themselves. Okay. And then you have the thing called the adaptive immune system, which is a thing that produced a particular antibody for that particular virus. Got it? And then your body has a microbiome. It's got a whole bunch of other systems. Bottom line is your body's like a orchestra. It's got many different instruments. However, the medicine that we practice today that vaccination is based on just playing like the oboe in the orchestra, okay? It goes back to 1915. It's all about, okay, we need that antibody. We need that antibody. It's like someone who just is a drug addict, just wanting a fix on something. You see what I'm saying? So the entire basis of Western medicine science is we got to get that antibody. Well, how do we get that antibody? Okay, so they created, starting in the 50s, polio vaccine and later measles. Okay, we're going to give someone, we're not going to let them interact with them. We're going to give them a deadened form of that virus with all other stuff added to it because it wasn't working. And we're going to inject it into their bloodstream, not in the normal way where people would hang out with other people, get chickenpox. So we're going to subvert the innate immune system. We're going to subvert the interferon system. And all we want is that antibody. You got it? So if we get that antibody, that person is great. So that was the origination of vaccines. Well, the science, I'm one of the leading guys in the immune system in the world. I was called 2 years ago to present at the National Science Foundation. The immune system isn't just that little oboe, okay? It's many other things. So that's been the history of that approach. And that approach also involves a modern mRNA vaccine, which I just did a whole talk on if people want to get educated. What that does is the mRNA vaccine, you're sending the messenger RNA of the RNA that will produce the protein in your own body using your own body's ribosomal mechanism of the same protein that's on the surface of the COVID-19 virus. Okay. So if you take the COVID-19 virus, you've seen those pictures, right? It's got all those spikes on it. Okay.
Right.
So what happens in the normal cases, COVID-19 enters your body tries to chomp it up. It's got a thing called a macrophage. It tries, like a monster, tries to eat up the virus, and it spits out all the parts of the virus, one of them being those spike proteins. It's called an antigen. Then your antibody system recognizes that, and it makes an antibody for that virus by recognizing that spike protein, okay? It's like a dog that sniffs it out and then tries to target that spike protein. That's an antibody. So what they're doing here with the mRNA is they're sending in the piece or the half a piece of the DNA that your body recognizes as though it's coming from itself. and it uses the own machinery to, guess what? What does it make? It makes the surface protein of the virus. And then your body says, oh, I got infected. And your body then creates the antibody. The old quote unquote vaccine model was you injected someone with the deadened form of the virus, and then your body made the antibody. Okay. Here, their theory is, okay, we don't have to culture the virus. We don't have to do that whole long process. In fact, the main thing is they avoid the regulatory process. And remember, vaccine manufacturers do not have to go through the normal regulatory process of even pharmaceuticals. They are considered a biologic. And thanks to the Kennedys, they don't even have to, if a vaccine hurts someone, they can't be sued. Okay? So pharmaceutical companies, by the way, are failing miserably. The pharmaceutical drugs, every year they spend billions and billions more in R&D. Even the FDA is not allowing their drugs because of the safety issues. So vaccines are the future of big pharma. So bottom line is the mRNA is heisting your own cellular machinery to make the protein. Now, there's been stuff about there's a gene therapy. Is it this? I don't want to go down there because it's not, we don't even need to go down there to critique it, okay? I want to go down there from a very practical systems understanding. The example I keep giving is imagine you're the orchestra conductor.
Okay, can you hold that thought? Let me take my break real quick because I have a feeling this is going to be what everybody wants to hear besides everything else you've said. So we'll be right back with Dr. Shiva right after this on 92.3 and 99.1 FM Talk.
So everyone, I'm talking to 99.1 FM, and we're going to have a number of discussions, but the main thing here is we're talking about, and I gave a talk on this yesterday to really talk about the immune system. So if you want to understand the immune system, think about it literally, as I said yesterday, it's like an orchestra, right? You go to an orchestra, there's 100 different instruments there. And when your body gets infected by something, your body just makes just antibodies and you're done. That's not what it does. Your body has a whole musical orchestra that gets lighted up, right? Macrophages and NK cells, and that's the innate immune system, right? When the virus goes into your eyes or your nose or your throat, right? So you get hit with a whole bunch of chemicals or cells, a bunch of forces, and your innate immune system tries to take it out. The second system that kicks in is called your interferon system. And I talked about this yesterday if you go look at the videos. And there's interferon alpha and there's interferon beta. And by the way, that's called the interferon 1s. Every cell in your body makes this. And no one talks about this. That is probably the missing link of the immune system, because when your body's under infection, the interferon system turns on. And then the interferon system is very powerful because it increases the activity of your natural killer cells in your own body and your CD8 cells. These are cells that take out infected cells. Very powerful. The interferon system does that, not the adaptive immune system that creates antibodies. All right. And then your antibody system kicks in, and the antibody system is for that very targeted virus. It can't handle anything else. So the point I'm making is that from a system standpoint, from a fundamental system standpoint, you have a whole orchestra. And when the entire basis of the modern therapy of quote unquote vaccines is just about, okay, great. So the entire basis here is only to bring up antibodies. And the theory is if you have that antibody, you're done. I say great. Yeah, I'm also streaming it as we're talking, so others are also hearing it here. Monica. Yep.
Well, I linked the...
So we're back with Monica, yeah.
A Baymaster mechanic invites you to schedule.
I linked the X-22 report that you did, the spotlight interview, and I get more hits on that than anything.
I say great. So anyway, what I'm explaining, I'm also streaming here, Monica. I was just explaining to people the importance of looking at the body as a system instead of just seeing it as a bunch of parts. Okay, great. Okay, we're back with 99.1 FM, but
Live and local right now. Monica J. on KKFT.
And we are back once again with Dr. Shiva. And if you missed any part of the interview today, make sure you check out the podcast at 991fmtalk.com. Dr. Shiva, as we were talking about the mRNA vaccine in the last segment, really what I'm getting from you is we are just this big, beautiful machine that we need to upkeep and make sure that we keep healthy.
You nailed it. And look, if the government and the powers that be want to talk about masks and vaccines all day, great, go do that, okay? And the people want to follow them, great, you have your choice. But if they spent an equal amount of time speaking about what I'm talking about here, which is we have to build community and boost immunity. You know, when you have friendships, when you have family, when you connect with other people, your body creates its own anti-inflammatories. The body is a pharmaceutical machine. There's a field called psychoneuroimmunology. Psychoneuroimmunology, your thoughts, they've shown that when you're happy, when you laugh, when you have connections, when you feel safe, your body will actually boost anti-inflammatories, boost antimicrobials. When you feel alone, when you feel depressed, like you have no friends, insecure, your body will actually be susceptible. So when we lock down people, when we told people to stay away from everyone, we hurt a lot of people. When you get sunshine, your body boosts antimicrobials. The bottom line is we wouldn't be around if the internal systems of the body weren't a word called resilient. So the issue is if we spend as much time talking about boosting immunity, you would have equal time. Let's say we do equal time that Fauci, as much as he talked about vaccines, or much as Biden talked about it, as much as even Trump talked about it. And I wrote Trump, as many of you know, March 23rd. I gave him a whole protocol. You know, his former wife, Marla, had it delivered to him. And I had a long talk with the domestic policy director, so I knew, but he kept following Fauci. He didn't take action, unfortunately, right? But if he had used that bully pulpit that he had, we could have had, this was an opportunity to educate people the body is a system. And that's why, you know, what I've done now, instead of waiting for anyone, you know, we've created a platform at vashiva.com. And I want to make sure all your viewers know about it. If they go to vashiva.com, our goal is you want to take these systems principles. We want to educate people that the same principles that drive your body are the same principles you can use to understand political systems. So what I've moved forward without waiting for anyone anymore is we have a movement called Truth, Freedom, and Health. And what that says is we must need freedom, the First Amendment and the Second Amendment. And using that, we can practice real science to get to truth. And with truth, we can understand the essence of real problems and real solutions, which in this case is boosting the immune system. And from that, we can understand what really helps our health. And from health, we have the strength to fight for freedom. Those principles I just said, Monica, is what I want to teach. It's a systems approach to understanding politics. It's a systems approach to understanding your body. So when we look at something like, you know, the election issue, right? How do we get to clean elections? You know, the Democrats keep diverting people to talk about, you know, voter suppression. And Trump had a huge opportunity and he didn't take advantage of it. It was all mail-in ballots, mail-in ballots. No, the real crime scene when you take a systems approach is not the mail-in ballots.
Dr. Shiva, I actually have to cut you off.
Okay.
We're coming into a hard break, but everything that Dr. Shiva has talked about is linked on my website straight to vashiva.com. God bless. Thank you, Dr.
God bless you.
Shiva.
Be well. And I'll continue. Thank you, everyone. So what I was trying to say was that what we've seen here now is that people do not want to go after the real problem in any issue, be it your health, be it the financial system, be it biological systems, be it, you know, voting systems. What we do is we create a dialectic. As I talked about, you'll see if you're on Facebook, I did this drawing of the eagle, but we have to take a systems approach. That's why, you know, I'm doing a lot of these interviews because we want to get the word out to the entire world that we have a solution, and that is a movement for truth, freedom, and health. And everyone, if you want to find it, you can go to vashiva.com/warrior, or you can go to vashiva.com/join. You can just sign up and you can start supporting the movement. It's the only force in the universe that's going to end the establishment's rule. It's the only force that is going to make you a powerful knight, a Jedi Knight, if you want to think about it, to be the light. And that's what we need. We need people getting educated on how the body is a system and how all these things are systems, but you need an educational platform. And the good news is all the years I spent doing the many things, I've figured out that system. And so you should go online line, go to vashiva.com/join. Just sign up for free if you just want to be a member. If you want to contribute, great. But when you contribute, as I mentioned, when you contribute, I want to give you more education. So become a warrior for truth, freedom, and health. But just go to vashiva.com/join and let's build this movement bottoms up. That's what we need. Otherwise, we're never going to get to, let's say, clean elections. We're going to think it's mail-in ballots, or we're going to think it's, voter suppression, and Democrats and Republicans are going to fight. The real issue is the fact that we have electronic voting machines which allow for computer algorithms. That's what the issue we have, that can flip votes so we don't get one person, one vote. Anyway, thank you, everyone. And that was our interview for today. Be well. Thank you. Be the light.